Hello, everybody, and welcome to MurseMonday, a weekly show that we do on this page just to bring a little bit of value to people affected by healthcare, involved with healthcare, or just strolling through and you see something interesting. Tonight, we have our first guest, and we are pleased to have her on this show. It's something that I'm surprised that I didn't know more about it, and so I'm excited that you guys are here watching today to learn a little bit about it. We got Erica Hornthal. She is the CEO of the Chicago Dance Therapy, and she's here to tell us a little bit more about it. You want to introduce yourself and tell us what dance movement therapy exactly is?
Sure. Well, thanks for having me. This is really exciting. I know we kind of just connected ourselves, so I really enjoy this segment that you've put together, and I'm so excited to be your first guest. But yeah, with that being said, I'm so interested in what you do, and I think we definitely have, a kind of a kindred spirit in a sense, because I know that you're working on and doing a lot of interesting things with music and music therapy. And so dance and movement therapy obviously goes hand in hand with that. Movement therapy at its very core is about using the body, and all of that entails. So it could be movement, it could be, posture, it can be gesturing, it can be something like walking, running, jumping, leaping. It can be, sitting in your chair and just observing somebody's body language or nonverbal communication. It's using all of that in a therapeutic context. So in the work that we do at Chicago Dance Therapy, we are all licensed, in the state of Illinois, we're licensed clinical professional counselors. And so oftentimes we're actually marrying movement with traditional talk therapy. And so when we're talking about working with individuals who have compromised memory or communicative, issues or cognitive disorders, we can continue to work with someone as they're losing their language, not only to continue the therapeutic relationship, but to continue to reach milestones, to continue to have an impact therapeutically, and to also encourage and even maintain some of those language barriers and brain connections.
Perfect. And so you touched a little bit on what the qualifications are. So you're certified. I was also looking at the adta.org, and that is that a company you guys work for? Or is that who does the certifications?
So the ADTA is our national board, so national association. So it's kind of like the American Cancer Association or the Alzheimer's Association. So it's a large nonprofit that governs us. So not only are they responsible for our board certifications, our registry, keeping us up to date on CEUs, and maintaining those ethical codes of conduct. So we kind of look to them to advocate for us. We look to them to uphold and kind of maintain those ethical standards. And if ever anything is going on with our field, or there are annual conferences that people can participate in. So that's really the board, that the association that really, again, governs us, is our representative body, if you will. And it really depends state to state. So at this point, dance movement therapy is only a master's level degree. So it's about a 3-year program. Some programs require a thesis. All of them require internships and apprenticeships, even practicum work. So once you finish your coursework and your internship and possibly a thesis, which, all in all can be anywhere for some people from 3 years to 7 years.
Wow, that's a commitment.
It could be a long time. You're then eligible to become a registered dance movement therapist. After 2 years of clinical supervision, you can sit for your board certification, which is a framework paper and basically a large session report showing that you can conduct therapy, you know how to be with your clients, and how to pick suitable interventions that are going to align with the goals that you've set forth for your clients. In addition to that, there's a lot to explain here, but in addition to that,
we're excited to learn.
Each state has its own guidelines for how somebody can practice private therapy. So again, I live in Illinois. In the state of Illinois, in order to be a dance movement therapist in private practice or group practice, you have to be licensed as a clinical professional counselor. If you want to join a group practice, you can be a licensed professional counselor. So the difference is just the amount of schooling, the amount of supervision, and the tests that you take. So
Wow.
honestly, I could practice as a counselor. I choose to identify as a dance movement therapist, and so what's wonderful is my license as a counselor also enables me to bill insurance, which doesn't always work for our individuals that have Alzheimer's, depending on how old they are. Licensed clinical professional counselors are not eligible to bill for Medicare yet. There's a lot of lobbying around that.
Wow, that could be a whole topic in itself then.
Exactly.
Yeah.
So, but it's good to know that some dance movement therapists, some music therapists, drama therapists, and even art therapists, depending on their licensure within their state, can bill private health insurance.
Well, that's wonderful, and that's the steps in the right directions. One thing that I found really interesting is this is started back in the 60s, right?
Yeah, so it's like 60 plus years old. It's not new by any means.
And you guys are highly educated. It really just blows me away that I've worked in this field for over 10 years, and something that after being more educated on, I could see such huge benefits or even potential benefits. Why wouldn't we try it?
Right.
And so this is just a great thing, and we really appreciate you being here.
Thank you for shedding light on something we think is really important.
Okay, I got a couple questions for you. Have you ever done any long-term therapy or any sort of long-term therapy, like someone that is initially diagnosed with dementia or an Alzheimer's or some sort of that related illness? Have you done anything from beginning and maintained with them?
Yes, so I've worked with individuals probably not at their diagnosis, but maybe within a year of their diagnosis. Again, it's kind of this, they have to know about us. We have to find
Right.
a referral source for them to know who to refer us to right away. Sometimes there's misconception in terms of what we do. But yes, I have definitely had the privilege of working long-term with somebody from around their diagnosis, through their diagnosis, and actually to their death. So
That's something I thought would be...
A couple years, that can be, a couple months. It really just depends on the age and just the overall health of that person.
That was something I saw so beneficial, is because eventually we will lose the way to talk, and with what I was learning from you guys is this is a way to communicate with these other nonverbal techniques, and if this is something that is going to happen, if we can learn to do it as we do it, could we live with the disease better? And I think yes, and so I think that'd be a huge thing. So I'm happy to hear that you have done some long-term therapies. Okay, now someone that's ever been nonverbal, like say the staff isn't able to communicate with them, and maybe they're showing anxiety, or they're showing different signs that, the way we communicate our nonverbal messages is very different, especially with the disease process. Have you ever been able to connect with somebody and communicate with them through their movement, or that's a later stage person that's not talking anymore?
Yes. So I would say that's... I have a handful of people, I would say, that are nonverbal. Oftentimes, we're just not connecting to them in the right way that actually allows them to verbalize what's going on. It might not make sense to us. It might sound like gibberish, but they're still able to communicate in some sense. So that is to say that I've had, again, a handful of people who are nonverbal for whatever reason. Either the approach hasn't been correct, or they haven't been engaged in an appropriate way that's going to spark conversation. And so what I find is it's a place and a way to validate their existence, to support their identity, to support the person that I'm seeing in front of me. The way I see it is nonverbal communication is the first language that we learn, and it's the last one. I mean, we can't forget it. We never forget how to communicate through our bodies. That's really what we rely on when we lose our communication, or when an illness like this kind of takes over. So yes, that's what I kind of pride my schooling on, is that I'm able to connect with somebody in their body without a word. And when either you're supporting somebody in their frustration, in their anxiety, recognizing it before it becomes a problem and then maybe preventing a hospitalization, or just being able to be with somebody through their anger, anxiety, and then being able to what we'll call modulate it into something more positive, into a more useful emotion that other people can engage with them in. Does that make sense?
As you're talking, it makes perfect sense. And as a nurse, I just really think that this should be something that we're more educated on, and maybe programs where you could come into different nursing homes and talk to the nurse aide or the nurse who's rushing around and working, that sometimes we don't remember some of these things that you're saying. And, you know, it's just an important thing, and that's why it's just blowing my mind the more that we go along, is that we need to educate more people on the opportunities that we have here, because a lot of these people are not communicating with words anymore, and we need to figure out on their level and in their world what's going on to resolve a lot of their situations.
Right, and you know, like you said, talking to the nurses, you know, so I think this is a big, I guess I just keep thinking of misconception, is that, you know, in some ways it can be it's stigmatizing, because we as dance movement therapists are called by the modality and the interventions that we tend to use, not by the type of therapy or the type of communication that we use. So first and foremost, not all dance therapists do, but I really see myself as a psychotherapist, as a clinical, even like a talk therapist for a lot of people. And so oftentimes people hear dance therapy, or they know that I work in nursing homes, and they expect that it's going to be entertainment. Or some people kind of pigeonhole us into movement or exercise. And if they come into the group and they notice that we're not moving, or the participants aren't, you know, copying my movement, that they're not engaged or they're not being successful. And it's quite the opposite. I'm there to support their movement. So it can be the smallest movement. I'm going to pick up on that, or I'm going to join them in that. And I think what you said really hit the nail on the head, is that we can be used in so many other capacities, not just to come in and do a movement group, which is great. You know, it certainly uplifts the milieu and changes behaviors and really supports the individuals where they are. But we could come in and do consulting. You know, we could come in and we can't teach dance therapy, but we can teach people to be more aware of behaviors, again, to prevent hospitalizations. That's always been something really near and dear to my heart that hasn't really taken effect so much, just because people are unsure of the possibilities of movement therapy.
Right. It's just making perfect sense, and I'm just glad that we're talking
I'm so
today.
Glad.
Are nursing homes receptive to you coming in, and if so, what kind of nursing homes? And we all know that there are different levels of nursing homes and different types. What are the ones that are most receptive to you coming in and support you the most?
So yes, nursing homes as a whole are very receptive to having me come in two capacities. One, I've been hired mostly through the activities department, because that tends to be where the budget comes in to have an outside quote activity. The other capacity is coming in to be with an individual. So in that capacity, it's really just getting the approval from the family, or having the family say, hey, so-and-so is going to be visiting mom or dad or whoever it is. You know, I don't want to say that every nursing home I've ever been to has successfully continued the program. Unfortunately, it does come down to budget.
Oh, yeah.
You know, availability, staffing. We know that there's a high turnover rate, and unfortunately, sometimes our connections leave, and we're not always supported, you know, not always told who the next in command is, or not even given that opportunity to kind of make that connection. And so, unfortunately, we leave the building. But our most successful programs have been, you know, with large buildings that have pretty much your age and place population, you know, so people everywhere from independent, they go down to assisted, kind of your all-encompassing package, so that not only can we support the individual, we can support them as they decline through their illness.
Right.
Mostly right now we're in memory care facilities, So, people who are pretty much mid to maybe even late stage in their dementia or in their Alzheimer's. And really, I tend to see that it's nursing homes that are really at the cutting edge of treatment. They might not have a lot of money, but they have the will and the need to think out of the box. They're not just going with what's been done for 30 years. They're really trying to think of what's going to work for the next 30 years. And proof and like trial and error, right? If we come in and they see an immediate difference, which they always do, they want to have us back. And
right.
So I've consistently been into buildings where it's like, well, we can only afford to have you once a month. All of those buildings I'm in at least once a week now, if not more. So it's, more in terms of dealing with different groups, throughout the week. But so it just takes a progressive vision. It doesn't take a lot of money. You just have to be really proactive with your budget and really make dance movement therapy or music therapy or drama or art therapy a priority.
Exactly. And, the thing is, I always say is that this is the first time in the history of the man or of human that we have outlived the capacities of our brains. Maybe it's because we're managing people's blood pressure, saving them from having these world-class surgeries, all these different things, so people are living longer. And maybe the dementia, Alzheimer's, maybe this already did exist, but we didn't live long enough to see it. And so we have to know that we can do better and that this is going to grow and evolve, and being open to different things like this. You would think, same thing with with the Memesto, is like you would think people would be happy and just hippity hoppity ready to go because we know about it, but just like I was not educated about dance therapy until I was like, why wouldn't you guys be in every nursing home is what I'm coming to think. So
well, that's certainly my thinking as well. I think a lot of dance therapists would agree with you. It takes a lot of education. It's a lot of getting in front of people like yourself or like this platform, and just letting people know really what it is that you do. It doesn't take skill. You don't have to be a dancer. It's about recognizing and treating the patient, mind, body, and spirit.
I love it. Okay, so present moment. This is one of the things that I like personally about this. I've always been into present moment meditation, really being grateful and satisfied for what you have exactly at the time. And what is the present moment application to movement therapy? Is there an exercise that we can share with the viewers today?
What is the present?
Am I cutting out?
Just say it one more time.
Okay, I just say, what is the present moment application? Is there some sort of exercise? Is there something that we can do to really be aware of the present moment? I just think it's a great thing. And is there anything that you could offer us?
Yeah, definitely. Sorry, it might have been my internet. It cut out for a minute. So, so first and foremost, this is for a lot of body-based therapies, but certainly in dance movement therapy, even as students, the first thing that we learn to connect with is our breath. And breath is really interesting because I think oftentimes we think you have to take a deep breath and then you have to let it go. And sometimes you can just be in your breath the way it is. And certainly that's what we do to assess a lot of our individuals. It's just noticing, is your breath shallow? Are you out of breath? Are you, controlling your breath? Are you really utilizing all of your breathing capacity? And so when you focus on your breath, you really have no choice but to be in the moment. So even if your mind wanders or, you're perseverating or kind of ruminating on something, which a lot of our individuals with dementia and Alzheimer's do, if we draw attention back to the body and allow ourselves to just acknowledge our breath and then maybe increase it with time, it brings us back to the present moment. Also, anytime you can incorporate senses, so whether it's sight or, smell or touch or even the sense of proprioception, which is our body in space, in a sense.
Wow. Yeah.
Tapping into and touching on those senses, again, allows us to really be in our bodies and not only, in our minds as well, but it takes the focus off of those thoughts that can be really weighing and heavy for a lot of us. Additionally, you can obviously do movement. So we talk about just the ability to sit in our chair and maybe reach up, right? Reaching down, which really taps into our identity and our core values. With a lot of my individuals, when we're in a group, I encourage them to reach out because it takes them out of their isolation and it actually
So just literally reaching out like this? Reaching out?
Reaching out to the side. So like reaching your arms out, yeah, there you go. And then, yes, reaching in front of you and also reaching behind is our ability to advance into our environment and also retreat into our environment. So it can be exploring, or it can be kind of, I think of sometimes like a turtle in its shell, kind of like coming back and evaluating the room.
That's so
those are great.
I love it.
You can do them when you wake up. You can do them at any age. You can do them with a parent. You can do them next to the person that is living with dementia. It takes some time, because if it's not, oftentimes we see individuals in a nursing home and the culture is really not moving. The culture has taught them not to move.
We put them in the Jerry chair.
They're sitting in a wheelchair.
We don't want them to fall.
Really encourage the movement.
You're right. It's so true. We do. We stick them in the chair, and we don't want them to fall, and we're not doing anything. And also, to look at life and look at the room and look at these with these different thoughts and perceptions, to sit back and look around and evaluate your space and your position on the earth. And I think it's wonderful. What are your experiences with doing this with a family? I see this as this could be a good bonding thing, like a bonding experience. Have you ever worked with a family?
Yeah, so I've had the pleasure of working with families in a couple contexts. So one, maybe a family member is the one that calls me and says, hey, mom, dad, ... got diagnosed with this currently or years ago, and we're needing some alternative approaches to connect and ease anxieties and tensions. So oftentimes I work with families in that capacity, because I always say, when I'm working with a client, I'm working with the family, regardless of age. But, I care about the family. I want to see how they're doing, how this disease is affecting them. They don't necessarily have to sign on for therapy themselves, but they're a part of the process. And if they can ease their anxieties, they can be there for their loved ones in a greater capacity. The other thing that I love is when we go into nursing homes, quite a few of them, when individuals come to visit their family members, they stay in the group, either because they love it and they've come to it before and they see the impact it has on their loved one, or because they enjoy it. And, they're like, this is my therapy, so not only do I get to be with mom or dad, again, whoever the family member is, but it's kind of a respite for me, and it's a way for me to engage with mom or dad, or, again, I just keep saying mom and dad, but that tends to be who we see.
No, it's so often I see people who are struggling to communicate and I always say it's because it's a lack of education. And so if you could help people to communicate with their loved ones on a different level, why are we not doing this more? I just keep saying that over and over to myself. Why are we not doing that more with people? So often, it's so typical. I get somebody in the hospital, it's like, yeah, mom's been getting lost for the last couple months, and this and this and this, and then it's just wham, bam, a whirlwind, and no one really knows exactly what to do, and it's not until you hit that moment when you start learning, and we're doing the best we can, but at that moment, these resources need to be introduced to people in a way. So hopefully someone's strolling along this and they could share this along the way.
Well, and we focus on what we're losing. That's the culture we're in, right? It's hard to focus on what you're gaining from a diagnosis like this, if you can think of it in those terms at all. But I think that there's some type of learning experience for everybody. And we kind of have to break down that stereotype or that barrier of concentrating on what we're losing. I think that we need to honor that, and we need to recognize what we're losing. But if you start to focus on what you still have and the potential, so my favorite thing to talk about is movement as a key that unlocks the potential of the brain. If you come in with what you can't do, you're going to be very limited. If you come in exploring possibility, you're going to leave with things that you thought never could happen and that your mom or dad or loved one could never do.
Right.
So, nursing homes, staff, it's usually like, this person lost their left arm to this. They are, paralyzed because of this. I don't really want to hear what they can't do, unless it's, they can't get out of their chair because they're a fall risk. Okay, then we need some staff to support us. But I don't want to hear physically what they can't do. I want their names. I want maybe a little background. What did they do? What was their passion? Are there any family members present? And then we just let the movement happen, and it speaks for itself.
Wow, that's wonderful. So have you done this with any companies, like team building exercises? Have you done this with, would this improve co-worker relationships to be able to communicate better?
I think so. You know, on our website, we do list corporate wellness. It's unfortunately now a very small percentage of the work that we do. But for the people that we have worked with, everybody walks away like, wow, why didn't we think about this before? Or, you know, oh, I thought it was just going to be dancing in the room. I didn't realize it was going to be using our bodies to communicate, or figuring out how somebody communicates based off of their body language. How, you know, when not to approach my boss based off of his body language,
right.
When to approach him because of the body language, you know. So yes, it's a very small percentage of the work that we've done personally, but there are a lot of dance movement therapists that practice movement analysis and movement pattern analysis, which is basically coding and identifying how we move in our bodies and how that can help with our communication skills. And that's happening all over the country. Again, I think on a very small scale, because a lot of people don't understand or know of the capabilities of movement therapy.
I always say we're at the beginning of even touching into like mindfulness and meditation and all these things. And as it grows, because it is growing, more things like music therapy and these other non-pharmacological approaches to managing, and also could get you the raise or the promotion that you're looking for. I mean, it's just, there is a lot to human and body language, and it's just an amazing thing. So that brings me into, go ahead.
How many medications do we take and see daily on the TV that have a full, like, some of the side effects are worse than some of them.
Yeah, a lot, most of them.
Some of the side effects are worse than some of the things you're actually experiencing.
Right.
I'm sure that's not necessarily the case with many illnesses, but so one of the things that I like to say is that these creative arts therapies don't come with a list of side effects. So it's like, worst comes to worst, you try it, and it doesn't have the effect you were hoping for. But most likely it will, and you're not getting any negative side effects because of it.
Why not try it? Why not? Why wouldn't you try this? And what you guys are offering and what you're doing. I've worked in this field for a long time. I've worked with these people, not only the family members, but the patients, and over and over through our conversation, I can just see, if you're watching this and you're touched by dementia, you're touched by Alzheimer's, you want to just communicate with your family better, I think dance and movement therapy would be a beneficial thing for you to look into. Now,
I just also want to say, like, because I know you yourself are in Michigan, there's actually a growing population of dance movement therapists in Michigan. So, of course, people can always contact Chicago Dance Therapy for any questions, but I encourage people to go to www.adta.org, and you can actually look up a directory, a full list of dance movement therapists in your area.
Wonderful. Can you demonstrate any movement therapy? Is there something you can do? I know it's not the best setting, but I think we can see.
So a lot of it's in the moment, and again, a lot of the movement actually comes from the individual who we are engaging with in the therapy. But like I mentioned, just some movement things that you can do at home or with your own loved one is really observing their movements.
Okay.
So if it's keeping a journal or just recognizing. Another thing you can do is mirroring. So it's more of an exercise. Sit across from your loved one and act as if you are a mirror for them. So we're not mimicking, we're not mocking them, but we're mirroring what we're seeing. And immediately it sets the tone for, this companionship, this partnership, rather than a power differential or, I know better. Again, some of those exercises, so just reaching up, reaching down, whether you're sitting or standing, again, taking those arms open and then crossing, giving yourself a hug, and then this idea of, again, reaching into the center of a circle or, reaching across to somebody, and then retreating back.
Yeah,
it covers
and really evaluating the space that you're in.
It covers all of the planes of movement.
I love it. It's a wonderful thing.
Everything has a connection to the brain. So for a lot of our clients, when we're crossing the midline, it's actually encouraging one hemisphere to talk to the other hemisphere, and we can actually maintain connections, but we can actually build some new ones.
Wow. This has been probably the best Merce Monday, I would say. Besides the ones with my kids, those were good ones too. I don't know if you saw those, my kids. They were special guests. But this has been an amazing time. I really appreciate your time. I'm going to say your website one more time, chicagodancetherapy.com. And like I said, I've done this for 10 years. I've been involved in this care. And as a worker, as a family member, as a husband, I think dance movement therapy is something that everybody should look in, and it may not have been something that I YouTubed and watched some exercises, but it's definitely something I'm going to watch now. We've touched on some of breathing techniques and being more aware of your breath. We've touched on a lot of things on this show, so I encourage you to watch this, share this with your friends. This is a weekly show we do, Merce Monday. I'm going to give you an opportunity to say your name and one question that you have, and any tags that you have. If you want to send anybody to social sites or your Twitter or whatever, go ahead and say that now, and I'll tag them in the comments too.
Sure. So again, my name is Erica Hornthal with Chicago Dance Therapy. You can reach us on Facebook. You can find us on Instagram, Chicago Dance Therapy. Also Twitter, which is CHI Dance Therapy. I guess a question I'd like to pose to everyone is, how do you move? How do you move? And something at Chicago Dance Therapy is called the Speak Your Body Challenge.
You cut out a little bit.
Taking a little body scan and just ask yourself how you move.
You cut out a little bit. Can you do that one more time? I'm sorry. Just the question.
Sure. In a nutshell, basically, how do you move? How do you move on a daily basis? And we encourage people to hashtag speak your body instead of speaking your mind.
There you go. Well, and then being aware of how you move in space and how you move, and maybe a stranger that you come across, maybe you have a negative body image that you, or a negative body motion that you would have never been aware of. So tomorrow, we encourage you to be aware of how you move, and post it in the comments and tell us, is there anything that you're aware of, or is there anything that you find out from this? And I encourage you to head over to chicagodancetherapy.com. And again, I really appreciate you being the first guest on Merce Monday.
Oh my gosh, I can't thank you enough. I'm so happy that you found me, and I just want to wish you the best of luck with all the amazing things that you are doing. And
I appreciate it.
Thanks for shedding light on a field that we think is very important.
And I'll see you guys next week on Merce Monday, and you stay tuned. Thank you.